Hello guys, do you know what is basilar invagination? So in this video I will describe about the basilar invaginations and the different lines to diagnose the basilar invagination. So what happens in basilar invagination? It is a craniovertebral anomaly as we can see in this image. It happens when the odontoid process of C2 migrates upward through the foramen magnum, compressing the brain stem and upper spinal cord. It may be congenital or acquired. And in case of the acquired condition, it is caused by the conditions like rheumatoid arthritis, bone softening, or trauma. Now the CT MRI findings of basilar invaginations and what it could do. There is a upward displacement of dens as we can see in this image. This red line denotes the upward displacement of dens. This is the upward displacement of dens. Narrowing of foramen magnum. You can see this is the narrowing of foramen magnum, and this will lead to the compression of brain, especially brain stem and upper cervical spinal cord. So we can see this arrow, yellow arrow denoting the compression of brain stem, and it is mostly associated with the Chiari malformation or syrinx formation. As we can see in this image, there is a syrinx formation in spinal cord, and symptoms caused by this is the neck pain, weakness, imbalance, numbness, or swallowing difficulty due to the compression of brain stem. To diagnose the basilar invagination, we must know the different craniovertebral junction lines and their measurements. So let's know one by one in detail. These are the different craniovertebral junctional lines: Chamberlain line, McGregor line, McRae line, Wackenheim clivus line, Claus height index, and Ranawat index. Let's know these lines one by one. So first one is the Chamberlain line. What is the Chamberlain line? It is the line drawn from the posterior tip of the hard palate to the posterior wall of foramen magnum, that is called the opistheal, and the dens should not be above more than 3 mm of this line. So this is called the Chamberlain line. Now next is the McGregor line. So it is the line drawn from the posterior tip of the hard palate to the inferior most curve of the occipital bone, as we can see here denoted by this green line, and dens should not be more than 4.5 to 5 mm above this line. Now third one is the McRae line. So McRae line is the line drawn from the tip of the clivus to the opistheal, that is the anterior and posterior wall of foramen magnum. This denotes the foramen magnum, and dens should remain below this line at least for approx 5 mm. So this is called the McRae line, and if dens goes above these criteria, measurement criteria, then this is called the basilar invaginations, and it will cause the complication like compression of brain stem. So let's see in X-ray image. We can see this is the Chamberlain line drawn from the tip of the hard palate to the opistheal, and the dens is below this line. Another one is the McGregor line, that is the line drawn from the posterior tip of the hard palate to the inferior most curve of the occipital bone, and dens is just above this line. Now third one is the McRae line, in which this denotes the foramen magnum, anterior and posterior wall, Bayesian and opistheal, and dens is below that line. So these are the lines for the diagnosis of basilar invagination. Now another line is the Wackenheim clivus line, that is the line drawn obliquely from the surface of the clivus, extends downward. So this is the line we can see here. These are the line. This is the X-ray image. This is the annotated image, and this shows the oblique line, and dens should lie tangential or just anterior to this line. We can see here this is the line drawn, and this is going tangentially, and dens should lie below and anterior to this line. This line should remain posterior to the tip of dens. Now the another is the Claus height index. So this is the index, as we can see in this image. It is a line drawn perpendicular distance between the tip of the dens and the twinning line. So let's know what is twinning line. It is the tuberculum torcula line. That is the tuberculum. This is the tube line drawn from tuberculum to torcula hierophyllae. So this is represented by this pink line, and this is the Claus height index, is the line drawn from the tip of the dens to this line, perpendicular line, and this should be 40 mm for normal, and if it is less than 34 mm, so this denotes that the basilar invagination. So another index is the Ranawat index. Let's know about this. So distance from the center of the C2 pedicle. So this is the C2 pedicle to the midpoint of the anterior and posterior arches of C1. So this line is drawn from the anterior and posterior arches of C1, and a line drawn perpendicular to that line is the Ranawat index. Normal value for this is the more than 15 mm in male and more than 13 mm in female. So this distance is more than 15 mm in male and more than 13 mm in female. And this is also called the atlantoaxial settling, and also known as the vertical subluxation, vertical translocation. So if this distance is altered or reduced, then it is called the atlantoaxial settling. So what is this atlantoaxial settling? It is a severe, often irreversible complication of rheumatoid arthritis in which upper cervical spine instability is there, and this will lead to the upward migration of axis into the base of the skull. If there is upward migration of this dens into the skull, then this will lead to the reduction of this value, and this will cause the atlantoaxial settling, and this is also called the basilar invagination, and this is the acquired cause of basilar invagination. Now this is the image showing the pre and post operated cases. So we can see that this is the McRae's line. So dens is above this. In normal cases, what happens? Dens should be below that line, but it is above this line. Also we can see that the Wackenheim clivus line. So this purple denotes the Wackenheim clivus line, and this dens is above and posterior to that line. These are my references. If you like this video, then like, share and subscribe. Thank you for watching.